Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today we wanted to talk about a very important topic, and it's all about what people are lacking these days. And it's really, really important because this is what is the essence of being, as an individual in life. If you do not relax, if you do not de-stress yourself, stress will take you one by one as an organ and damage it. And relaxation not only is about today's topic, it's always about your entire life that you are, struggling, stressing and holding on to things and making materialistic things as priorities and all that. So today we're going to go quickly and talk about relaxation techniques in labor and delivery. Relaxation techniques are really, really important because every woman, when they are going and entering into labor and delivery, they are coming with some fixed notions. Okay, some fixed notions of what their friends have told, of what their parents have told, or relatives have told, or what they have had in their previous experiences and all that. That is not what should guide you. You should believe in yourself and you should see the world with your own eyes rather than somebody else's experiences. And when your brain is fed that kind of an information and it is going through that tubular vision, what is given to you through other people, it is causing lots of problems. So I don't say that everybody has this kind of a challenge, but yes, in my experience from past 22 years, I'm seeing people live their pregnancies through somebody else's eyes and live their labor and delivery through somebody else's eyes and their child rearing through somebody else's eyes. This is absolutely not warranted, and the power of knowledge, the power, the empowerment that you're getting should always give you that enlightenment into your life and give you that vision and determination to do things yourself, to learn things yourself, to understand things yourself and live by your life as an example and experience pregnancy, childbirth and child rearing, the beauty of what is there in your body and your way of living. So do not go by others' experiences. Do not go by anybody's advice or all. So it is you and your doctor who are going to take this forward and make it as a beautiful journey, be it pregnancy or childbearing or the delivery part or the postpartum part or child rearing part. So make your pregnancy more interesting by learning what is happening within you and to you rather than by somebody else. All information is not necessary. Enjoy your pregnancy. So when it comes to relaxation techniques, there are several relaxation techniques that are there, and partner support is very important, and every delivering woman in labor needs some kind of a support, along with the doctor, along with the nurses. There should be some close person to her heart that she needs to get while she is in labor and delivery, so that she will have that option of togetherness and option of that extra aura along with her aura to encourage her to have a normal delivery. And when you have to talk about relaxation techniques, you have to use all your senses, all your five senses, all your attention, all your powers for that D-Day to have the best of outcomes. And we will go one-on-one so that you will easily understand what I am talking about. Especially when women are in labor and delivery, that's a very slow process. So the contractions start and they go one step, one step forward, and it is not a rush of contractions and super pains coming suddenly. So when she's stepping up into contractions, it is very important that she uses these relaxation techniques to understand where she can get that help from. So the first point, we will come to the five senses, and when it comes to the five senses of using, first, I say is the vision. Okay, when it comes to the five senses, what she visualizes, what she concentrates, what the couple or partners concentrate is what they usually end up having. Okay, if you visualize, if you concentrate, if you have a focal point concentration on one thing, that one thing can be a beautiful scenery, the one thing can be a baby's picture, that one thing can be the picture that you like, the thing that you like, or thing that encourages you, inspires you. So concentrate. If you concentrate on a particular object, or a scene, or a target, your concentration will help you get you away from pain. So it will help you get you away from the main channel of things that are worrying you during labor. So focal point concentration and visualization are very, very important, and the partner can help you in this by constantly talking about that part and constantly encouraging you on that part, and telling you how determined you are, and how challenging that you can be in your output, and you can do it and you will do it. These kind of things matter a lot. And whatever is around you, okay, whatever you're visualizing in the labor room definitely has an impact on you. And people who are encouraging you, who are talking good and talking in a positive manner, will definitely help you have a normal vaginal delivery. Now, other than the visualization part, there are several mechanisms to enhance the chances of having a natural birthing. For example, there is water therapy. Yesterday we did about water birthing. Now there is water therapy also. When you are in active labor, not the very early labor, when you are in active labor, warm water showers and taking bath with lots of warm water can relax your muscles and accelerate labor, to an extent that when we give warm water bath to good contractions people, but they are not opening up, that helps a lot. And it is one of the mechanism that it's one of the secret of progressing labor very easily. And there are people with me who do that, and they do it very excellently, and I have seen that benefit coming through this kind of a water therapy. And whenever they are going to go for taking a bath or having this warm water shower, or hydrotherapy is what I call it, and we give lots of hydration also, lots of water for the pregnant woman to drink. If not water, coconut water or some kind of a warm juice or anything like that, so that that hydration in her body also maintains and she's not dehydrated. And other than this, tactile sensations are so very important in labor. Everybody responds to touch, so it is very important that tactile sensations in labor play a very major role. And you can have that emotional tactile sensations when your partner is hugging you or kissing you, or whenever there's a hard contraction that is coming, you give a good bear hug to your wife, or you can have a very intense kissing action, or intense holding together action, or supporting her. So these kind of touch sensations also help a lot. In this touch sensations come massages. In this touch sensation and enhancing effect comes the acupressure points. The hydrotherapy also comes in touch sensations. The reflexology, the foot reflexology also come under the touch sensations. Lot of massages. And what massages do? They release endorphins, they release monoamines. And endorphins and monoamines are the ones who control the entire process of pain. And somebody who's having a good massage, with the hand movements, with the knuckles, with the fist, nice hand movements, or nice deep pressure movements, or we have rollers to do that, we have little pointed rollers to do that, and we have some pressure points to hold on to. So all these things deviate the concentration from pain and enhance relaxation. And not only enhance relaxation, they also release endorphins and monoamines, which decrease the pain sensation. And now when it comes to massages, there are therapists who do that in our hospital. There are therapists who are going to help you with all these things. But a familiar touch gives you a lot more happiness. And that familiar touch is of your husband or your mother or your sister, or especially when it is partner support, it gives a lot of good results. And you feel the sense of security, you feel the sense of belonging, you feel the sense of positiveness that comes when the partner is around helping you in labor. And you don't feel alone, you don't feel left over, you don't feel that this is all going around you and you are the scapegoat. And all these things won't come in when the partner steps in and helps you out with all these things. To guide, we are there. To go ahead, you should be there. And whatever gives you relaxation, you should be doing it. And relaxation techniques can be a lot of them. You can have nice music playing, some soothing music playing, whichever music album that you like, you can play, or you can dance for some songs. And I have so many people whom I dance together, and they deliver in an hour and a half, and that has been the norm since a very long time. And I have experienced it personally myself. Music makes lot of difference, and it can be whatever music that you like, that stimulates your well-being, that relaxes you, that relaxes your ligaments and tendons that are causing tightness, and relaxes your brain, so that your brain is not inhibiting labor. Once that inhibition goes off, the labor progresses very fast. And you can do those intense relaxation movements like inhaling or exhaling, and deep breathing movements that help you a lot, because deep breathing movements improve the oxygenation in your body, and the oxygenation that improves in your body gives that strength and blood supply to the muscles to go through labor and quickly finish off the labor. So that's very, very important. And you can have those sound waves like ocean waves, or birds chirping, or music. There are people who listen to authentic music, that whatever the religious music that they know. And some people listen to hip, some people listen to pop, some people listen to trance, some people listen to Bollywood. So it all depends. And there is music of Yanni and Enya. So this music is some kind of a relaxation that causes in labor. So it is very important. And when you program yourself during your pregnancy, so some people have the habit of listening to music. So if you get yourself programmed to listening to music during pregnancy, that music will have a lot of influence to relax you even in labor. So programming starts even before you go into labor, and it even starts when you're pregnant. So try to listen to something and make notes of things that are giving you relaxation, and those are the things that will work for you in labor. And there is several there's several advantages when partner is in help during labor. And with music, you can have a ball dance, or you can have a Zumba dance, or you can have any pelvic movement improving dance that we already have in our house, in our hospital. So we guide them, and they go through that, and they feel bliss and relaxation. And as a matter of fact, very it gives a very beautiful experience to them. And other than the sound, we have a lot of influence of smell. I'm telling you, every sense, 5 senses it makes a lot of sense to include five senses into labor and delivery. When it comes to sense of smell, whatever smell that you like, maybe it is lavender, maybe it is jasmine, maybe it is some aromatherapy oils, maybe some incense sticks, maybe some favorite uh, mm, some of your clothes that smell with your favorite perfume, whether it is a t-shirt or a blanket or some aromatherapy, whether it is the smell of roses, whether it is smell of lavender or some geranium oils. They give a lot of tranquility and relaxation. So this tranquility and relaxation is really, really important for somebody who is having a lot of exposure to pain and stress and all that. And jasmine and sage are the ones that usually give that kind of a huge relaxation to encourage labor and birthing. And lavender calms people, and when you're apprehensive, when you're shouting, yelling, the smell of lavender calms you down. You can have a diffuser in the labor room. You can have some kind of a mechanism that is running. So all these preferences come when you really look into exploring things during pregnancy. Set your preferences and come to labor and delivery with some kind of a positive attitude, and these things will definitely work out there also. So sense of smell is also very, very important, and you can enhance labor and delivery and outcomes of labor and delivery with every single technique that you use, and every small thing piles up for good relaxation and progression of labor. And when it comes to taste, the next five senses is the taste. So whatever you like in terms of the food that is light on you, whatever you like, you can have during labor, especially complex carbohydrates and foods that are rich in vitamin B. They help in the first stage, and rich nutrient snacks are helpful in the second stage. And keep yourself hydrated by having coconut water or some warm soup or regular intake of water, or whatever that feels good to your palate. You can sip on those things, and they will help you relax a lot. And there is no question of keeping you without food and without water during labor and delivery, because it is not warranted. And normal labor and delivery is something that is really, really close to normalcy, and you should not fix anything around that thing. So for the taste sensation, you can have foods that you like, you can have things that will help you relax. And food is something that I have seen so many women who are foodies and turn aversion to food during labor. But if you keep that pace, to food, you will definitely have that thing coming back to you. Especially, I'll give you an example. There are at times when you feel dehydrated, when you feel low, when you feel you don't have energy. If you have one coconut water, you have that charge in your body, because it has got electrolytes, it has got fast releasing sugars, it's an easy drink on, and you can just sip, and it doesn't have much of a different kind of flavors, it's not strong and all that. The same thing, if you have it in labor, you feel so good to your soul, and you feel hydrated, you have that instant energy to push whenever you require. So it is important that you have that taste sensation also on. And we were continuing about touch sensation, wherein little bit of acupressures and little bit of hydrotherapy, little bit of reflexology helps a lot. Gentle pressure with your hands, with your fingers, make lots of difference in terms of improving the blood supply. Kneading your shoulders, thighs, and back, and your thighs will help you a lot improve the blood supply and decrease the pain sensation. And a nice bear hug can release a lot of endorphins, lot of dopamine, and it can give you pain relief. And there are several things like that to go through and take you through in labor. And even if the partner is just stroking little bit on the shoulder, on the hands, on the forehead, and in the back, and on the legs, or in the soles, it gives lot of relaxation, and they keep asking for it because they feel it's really, really good. And for somebody who's having a slow labor, we have acupressure points and reflexology points wherein we pull the second and third toe of both the legs minimalistically with both the hands, and we ask the partner to do it that, so that the labor progresses very easily. And in active labor, center of each arch of the foot is pressed with both the thumbs, so that with nice deep breaths the active labor progresses. So there are several points and pressure points that really help, and it gives extreme relaxation in childbirth. And we and especially I have trained the entire staff in all these things, and they keep doing it, and they keep doing it, and they keep doing it. It helps them a lot, and subconsciously also we know what we have to do, and the woman is also experiencing that. It is not always that we need to train the woman. Once we are doing it, they understand it and they progress. So we have several techniques that really work on, and relaxation techniques are the essence in having normal delivery. It just doesn't happen all of a sudden, and it just doesn't go with a very fast pace unless and until you try to improve the quality of it. And whenever we talk about thoughts, thoughts are very important for pregnant women. She should always have positive thoughts, and thoughts are something that they hypnotize you. If you constantly believe one thing, that happens. And if you constantly believe that you will have a delivery, your baby will deliver to normal delivery, your baby is ready, and your baby will you will enjoy that motherhood, and you will have that first hug and a first kiss and a first breastfeeding session. All these things you constantly think about, your mind is always in that tuned mechanism. So that's why we call it's all about mind over matter, and it's just not a joke. And whenever you have you have strong intentions, strong beliefs, you will succeed. And that is what we try inducing from pregnancy day one antenatal care checkups. You will do it. That is, it's nothing for you. You will just finish it, and you will have a cakewalk. If you definitely do that kind of a counseling, you will definitely have very good results. And you can have in your thought process, you can ask the pregnant woman to know what is happening to her, where is her negative forces going, thoroughly scan herself and tell which is the area that we need to focus. And that area that we need to focus, if you focus by massages, if you focus by some therapies, if you focus by acupressure, they will go into labor and delivery faster and finish delivering. And these kind of a relaxation techniques are very important. And in your thoughts, in the pregnant woman thoughts, if we induce progressive relaxation, we keep telling them, relax your head, relax your eyes, relax your breathing, take deep breathing, relax your neck, relax your shoulders. Similarly, we keep inducing thoughts that give and produce relaxation. And we also induce thoughts that imaginary thoughts that we try to pull her into that kind of a basis. When she's constantly in pain and shouting and yelling, we try to deviate her from that and talk about something imaginary where she will find relaxation, and she will meanwhile get deviated from the kind of pain that she is having, and the contractions will do their job and you do your job. So relaxation techniques are really important. And with all these things going hand in hand, breathing techniques are very important. When you breathe, you give oxygen to your body. That is one of the vital factor that gives life into you and into the baby also. So breathing techniques are very important. Whenever you have contraction, you take deep breaths. Deep breaths will help oxygenation. Whenever you are having relaxation, just breathe normally. So these kind of breathing techniques and the tips to how to breathe and when to breathe and what is the intensity of breathing, if you train them, definitely they will have a lot of relaxation. And it is one of the way for the partner also to encourage the delivering woman to breathe and keep breathing and keep enjoying that labor and try to do things together. And there are people who in their early stage of labor. They do baking, they make cupcakes, they even make cake and get to labor. And there are people who hydrate themselves, there are people who eat light, there are people who watch a movie, there are people who kind of fold clothes and keep the house going on, so that once the labor and delivery is finished, he'll enter the house with who all completed work house. And there are people who fill books, there are people who do artwork, there are people who do crochet, there are people who do knitting. There are several forms of deviation from pains and contractions, especially in the latent phase and early phase of labor. So it is all that you have to know. It is all that you have to be knowing what relaxation techniques is. Labor and delivery is not about just lying down and pushing. It's not labor and delivery. Labor and delivery is a beautiful experience, and you can take it the way you want forward. And to an extent, even as a doctor, I know I can judge people that this person will progress in this phenomena very well. This person will not be able to do this. This person, we will tailor make this kind of a mechanism. So that tailor-made decisions I do, tailor-made decisions that I do, my team executes along with the support of the partner. So these are very important to take forward labor and delivery in a very smooth fashion. So this is all about relaxation techniques, all about using your 5 senses, like your visualization, like water therapy, like massages, like sound, using sound and music, using the sense of smell and taste, using the sense of touch, using the sense of massages, using the sense of thoughts, using the sense of breathing techniques. And there are innumerable mechanisms that we can use to relax a mother in labor. And with the help of partner, all this is possible, and it will lead to a blissful, natural birthing experience. And this is all what we want. And we want to take this art forward and definitely look into the future of obstetrics, the future of delivery, the future of a happy mother and a happy family, and every beautiful delivery experience possible. So this is all about labor and delivery and promoting natural birthing and normal delivery. It is all about relaxation techniques. It is all about partner involvement, family involvement, friend involvement. It is all about giving women their right to a safe and happy delivery. So we'll catch up tomorrow with another good session on labor and delivery and a beautiful topic to cover. Thank you all, and keep watching and follow my YouTube channel. Thank you all so much. Thank you all for watching.